Bismillahirrahmanirrahim. Hello everybody. A stillborn male fetus is brought to autopsy for evaluation. The fetus was delivered at approximately 36-week gestation to a 26-year-old woman, gravida 5, para 1 and abortia 3, who received no prenatal care. The mother came to the hospital and active labor and ultrasound on admission revealed no fetal cardiac activity. She had an uncomplicated vaginal delivery of the stillborn fetus, weighed 2.2 kg. The mother had a prior healthy female infant via normal vaginal delivery at 39-week gestation and a 3 subsequent elective termination of pregnancies. She does not use tobacco, alcohol, or illicit drug. The fetus has a short, bent extremity, and X-ray revealed multiple limb fracture and a hypoplastic thoracic cavity. Which of the following is the most likely cause of these fetal abnormalities? Achondroplasia, amniotic band sequence, birth trauma, osteogenesis imperfecta, Paget disease, Poiter sequence, vitamin D deficiencies. So this patient, this fetus was delivered at 36 weeks of gestation, and ultrasound revealed that there is no fetal cardiac activity. There is intrauterine fetal demise associated with growth restriction, and the fetus is short, bent extremities. X-ray revealed multiple limb fracture and hypoplastic thoracic cavity. So the diagnosis of this question is osteogenesis imperfecta type 2. Diagnosis of this question is osteogenesis imperfecta type 2, and here the correct option is choice D. Why the choice D is the correct option? Because an intrauterine fetal demise associated with growth restriction, multiple limb fracture, and a hypoplastic thoracic cavity is consistent with type 2 osteogenesis imperfecta. Type 2 osteogenesis imperfecta is an autosomal dominant disorder due to defective type 1 collagen synthesis that result in decreased bone density and increased skeletal fragility. Type 2 osteogenesis imperfecta is typically diagnosed via antenatal ultrasound, finding of multiple fracture, a shortened femur, and a hypoplastic thoracic cage, and growth restriction. Type 2 osteogenesis imperfecta is lethal. Most fetuses either die in utero due to delivery, due to trauma, or shortly after delivery due to pulmonary hypoplasia. Come to the incorrect one, achondroplasia. So achondroplasia is a non-lethal autosomal dominant bone dysplasia that present with macrocephaly, frontal blossing, mid-face hypoplasia, gene verum, and limb shortening. Choice B, amniotic band sequence. Amniotic band sequence is associated with limb defect, that is amputation, hand defect, cleft foot, craniofacial defect, and our abdominal wall defect. Choice C, birth trauma. So birth trauma is most frequently associated with fetal macrosomia and shoulder dystocia. Choice E, Paget disease. So Paget disease is a bone metabolism disorder due to defective osteoclast activity. This disease typically has an adult rather than an utero onset and present with headache, hearing loss, spinal stenosis, and osteosarcoma. Choice F, Poiter sequence. So Poiter sequence is a lethal fetal anomaly that present with pulmonary hypoplasia, limb deformities, that is cleft foot, hip dislocation, and oligohydramnios. This is due to urinary tract abnormalities, for example, bilateral renal agenesis, polycystic kidney disease. Choice G, vitamin D deficiency. So maternal vitamin D deficiency is associated with fetal growth restriction, not with fracture or intrauterine fetal demise.